service and manufacturing industries. And they are, among others, who've borne the consequences of the disease. Mitigation measures have been implemented in many countries, but are failing to stem the impact. Globally, 41% of workers in the poorest 20% of their country's income distribution said they lost their job or business as a result of the pandemic, compared with 23% of workers in the richest 20%. To discuss some of these broad issues, we're joined by Dr. Christoph Niewoudt, who is FNB Chief Data and Analytics Officer. Thank you so much for speaking to us. Now, as the spread of the virus is likely to continue disrupting economic activity and negatively impacting manufacturers and service industries, I want to look at developing countries such as South Africa. It's had an impact on our financial markets, which will obviously continue to be volatile. But what about the ordinary man on the streets? There's some people who've struck it lucky, but there's some people, especially the poor, who've been bludgeoned by the impact of COVID-19.
So that's right. I mean, our data, and we've been tracking this from the start, the economic impact was severe, but the economic impact was actually largely due to the lockdown in April. And our data showed that from May onwards, both incomes and expenditure of customers started recovering very well. So in April last year, we saw a 23% reduction in income on our entire base. But that has now washed through, where our base income for our base is up on a monthly basis. As expenditure plunged by 60% in the month of April, but that is also up year on year. So we've seen actually a good economic recovery. I think the big thing now is how to get the vaccines out, because we've got some interesting data as well on what's happened to mortality.
Okay, so perhaps let's share that with us, and we're going to try and forecast how this is going to change, because everybody has been looking towards a vaccine as something that will help recovery, not only socially but economically as well. But so share some of that data first with us.
Yeah, I think the first point is that it really impacts the elderly significantly more than younger people. So we can't actually measure the COVID deaths per se, but what we do is we measure over the peak 3-month period that of the first two waves, and we then take the aggregate mortality on over 8 million customers, and then we found some very interesting things. Below the age of 40. Actually, we showed lower deaths during the COVID peak months than we normally do. Now, that doesn't mean that nobody died of COVID. It just means that the mortality rates for COVID for young people is very, very low. Between 30 and 40, it was pretty much neutral. But then from 40 onwards, it increased somewhat by 30%. For 50-year-olds, it increased by quite a bit more. And for 60 to 70 and 70 to 80s, 70 to 80% increase in mortality over those months. So the elderly are really what we have to protect with the vaccine program. So, the phasing according to age is really the starting point for that program.
Okay, so I think when we mention COVID-19 as being the great equalizer against the backdrop of that data and the impact that we'll see through the vaccination drive, there is the main question, though, whether this unfolding crisis will have a lasting structural impact on the domestic economy and also largely the short-term financial and economic consequences.
Yeah, so we think that the economic impact is washing through. I think the biggest impact we saw was the lowest income earners, which you mentioned, but ironically also the highest income earners, because many of these individuals are self-employed, so their own SME businesses that they derive their money from were the ones that were the hardest hit as well. But then from a mortality point of view, I think looking at income is actually COVID has been a great equalizer. Great is probably not the right word. It's been a terrible equalizer. I guess normally people with more money have got better health outcomes, whether they actually have better access to healthcare, whether they have better education around, lifestyle and or ability to exercise, etc. Clearly, you normally see that pattern where the mortality rate goes lower. Now, we saw with COVID that actually inverted, where our middle income base showed, the sharpest increase in mortality between 70 and 80% in middle and upper income increase in mortality due to COVID. So clearly, having money, you can't really protect yourself from COVID. And I think one can understand it because there isn't really, beyond the basic treatment, there isn't that much more that you can do. So that's why we still say vaccine is really, the way to go to reduce the mortality rate.
So I want to also look at another gap. It's very interesting when you talk about that because what has been said is that not only has the impact on the productive economic activities changed, but consumers also typically change their spending behavior mainly due to the decreased income and household finances. But that's out of fear. That's out of fear and panic. So how are industries going to remedy that? I'm looking at the service industries, hospitality, transportation, because they've suffered significant losses.
I think you're right. The only sector that we're showing that is still down on a year-to-year basis is the tourism, and obviously hospitality and accommodation goes with that, right? So that sector has got a problem, and I think if one can actually get people vaccinated, then the mortality rates, the reductions in mortality from vaccination, even hospitalization dropping by 85% on the trial studies. It just shows that it would be a lot safer, for people to travel. I do think we need an integrated approach, but clearly that would be one of the big ways to actually address that sector. And like I said, many other sectors actually have found, ways of coping with COVID, whether it's work from home, whether it's actually online shopping for many, industries have been very resourceful in coping with the new demands of COVID.
All right, thank you so much for speaking to us. And that there is Dr. Christoph Niewoudt, who is FNB Chief Data and Analytics Officer. We're going to take a quick break. Do stay with us.